We understand that contraception might be the last thing on your mind immediately after giving birth. However, it's important to look at the available options, as many unplanned pregnancies occur during the first few months after childbirth. If you want to avoid or delay another pregnancy, it's best to be prepared. You need to think about contraception as soon as you start having sex again. It is possible to become pregnant from 3 weeks after giving birth. Don't rely on your periods starting again as an indicator of fertility. An egg is usually released from your ovaries about 2 weeks before your period arrives. This means you could fall pregnant before you get your first period. There are lots of different methods of contraception available. Choosing the right one for you will depend on you and your partner's preferences, your medical history, whether you are breast or bottle feeding, and when you decide to start your chosen method of contraception. When you start using contraception depends on your chosen method of contraception and whether you're breast or bottle feeding. The following methods can be started at any time after birth, regardless of whether you're breast or bottle feeding. Condoms, the implant, the progesterone only or mini pill, and the injection. The copper and hormonal coil can be fitted at 2 different times, either within 48 hours of giving birth or from 4 weeks after having your baby. If you're not breastfeeding and do not have any risk factors for developing a blood clot, then the following methods can be started 3 weeks after birth: the combined pill, the contraceptive patch, and the vaginal ring. If you're breastfeeding, you will be advised that it is safer to wait until 6 weeks after birth before starting the combined pill, contraceptive patch, or the vaginal ring. From 6 weeks after birth, it is safe to start using a diaphragm or a cap. If you have chosen to use a hormonal method of contraception, such as the pill or implant, then a small amount of the hormone will enter your breast milk. No research has shown that this will harm your baby. Breastfeeding can be used as a method of contraception. It works by delaying the release of an egg from your ovaries and stopping your periods after birth. Breastfeeding stops 98 out of 100 pregnancies in the first 6 months after birth, but only if all the following statements apply. You haven't had your first period after giving birth, your baby is less than 6 months old, and you are exclusively or nearly exclusively breastfeeding. This means that you are only ever giving your baby breast milk or very infrequently giving them other additional liquids. There is an increased chance of pregnancy if you use supplement feeding, you aren't regularly breastfeeding, you stop feeding overnight, your baby is more than 6 months old, or your periods return. For further advice on contraception after having a baby, please talk to your midwife, health visitor, or GP.